Next on First News at 4 o'clock, electronic cigarettes are everywhere and they're gaining in popularity. Tips for parents about how to talk to your kids about the dangers of using these products when we come back. E-cigarettes are quickly becoming a very popular product across the country, with some fear that devices will only encourage kids to start smoking. The FDA has proposed rules to ban the sale of e-cigarettes to minors, but how do parents talk to their teenagers about the health risks? Joining me now is Dr. Alexander Park from Pacific Medical Centers to help us out. Thank you so much for being here, Dr. Park.
My pleasure.
We were just talking about how a lot of parents don't even fully understand how the e-cigarettes work. So tell us what they are and how they compare to cigarettes.
Right. Well, the electronic cigarette is a device. It's designed to look just like the regular cigarette, but it delivers nicotine in a very different way. So unlike the tobacco cigarette, where you have to light it to burn tobacco, thereby generating smoke, which you breathe in to introduce nicotine, electronic cigarette's a device. It has a little cartridge of nicotine that's a liquid, and there's a battery-powered atomizer that vaporizes that liquid nicotine, and you breathe that vapor in. So it's seen as advantageous because it's smokeless, and it's generally odorless. So it's quite a different device.
This smokeless aspect of it has a lot of people thinking, oh, this is the safer way to smoke. This is safe. This is healthy. It's okay. It doesn't hurt me as much as a traditional cigarette would. That's not true at all.
Well, I think the long-term safety data is certainly up in the air. I hope it ends up being safe. A lot of patients are using it, and we in the medical profession would be very relieved if it turned out to be. But I think there are a lot of concerns with it. Number one, the chemical that contains the nicotine, propylene glycol. That's how it's suspended in that liquid, and that's found in plastics and antifreeze, not things that you typically consider to be safe for the human body, and the long-term effect of inhaling that unknown. As well, the particle content has about 100 times the heavy metal load that you find in the smoke of the tobacco cigarette. We're talking about heavy metals like lead and tin and copper, all of which can be poisonous to the body in great quantity. And so again, the long-term health effects of that over time unknown. And you know, these devices have been only around since about 2008, so we just haven't had the time to study them in the depth that we need.
Why do you think that this is gaining in popularity among young people?
Well, it's marketed very heavily. It's marketed as safe and as a great alternative to smoking. It has none of those harsh burning qualities that the tobacco cigarette has, and it comes in all these wonderful flavors, coffee and menthol and candy flavors, so it's a very accessible product. It's a very pleasant product for them, and it also happens to be cheaper than the regular cigarette. And if you add all that together, you've got something that's a recipe for success in the marketplace, and certainly people are using it a lot.
How should parents talk to their kids about this product?
I think the great way to start is by asking them what they know about these e-cigarettes. So starting by asking what they know, and that gives you a chance to hear what their thoughts are, and some of the myths that they might be sharing with you, you have a chance to dispel, and certainly to share with them that it's probably more dangerous for kids to be using it than adults. Nicotine is particularly worrisome in children. The young brain is far more adept to developing addiction than the adult brain, and setting our young people off on a lifetime of addiction is very challenging.
Some scary stuff, really.
Indeed.
Dr. Park, thank you so much for being here.
My pleasure.
Very helpful information. Coming up next.